580,769 tests for coronavirus have now been carried out in the UK, including 91,206 tests carried out yesterday. 243,303 people have tested positive. That's an increase of 3,142 cases since yesterday. Unfortunately, due to technical issues, Northern Ireland have been unable to process any testing data for Pillar 1 today. Today's daily totals therefore reflect Pillar 1 data for Great Britain only, excluding Northern Ireland. Northern Ireland are looking to resolve this issue as soon as possible, and we will update the data when we can. 10,035 people are in hospital with COVID-19, down 15% from 11,817 this time last week. And sadly, of those tested positive for coronavirus across all settings, 34,636 have now died. That's an increase of 170 fatalities since yesterday. Our thoughts are very much with the families and loved ones of those who have lost their lives. Before talking about the work on vaccines and taking questions, I just want to remind everyone of the details of the next phase of our fight against coronavirus. Could I have slide 1, please? So first, in order to monitor our progress, we have established a new COVID alert level system with 5 levels, each relating to the level of threat posed by the virus. The alert level is based primarily on the R value and the number of coronavirus cases. And in turn, that alert level will determine the level of social distancing measures in place. The lower the level, the fewer the measures. The higher the level, the stricter the measures. Throughout the period of lockdown, which started on March the 23rd, we have been at level 4. Thanks to you, people across the country, we have collectively helped to bring the R level down. And we are now in a position to begin moving to level 3 in careful steps. Slide 2, please. We have set out the first of 3 steps we will take to carefully modify the measures, gradually ease the lockdown, and begin to allow people to return to their way of life. But crucially, whilst avoiding what will be a disastrous second peak that overwhelms the NHS. After each step, we will closely monitor the impact of that step on the R and the number of infections and all the available data. And we will only take the next step when we are satisfied that it is safe to do so. As the Prime Minister announced this week, as part of the first step, those who cannot work from home should now speak to their employer about going back to work. You can now spend time outdoors and exercise as often as you like. You can meet one person outside of your household in an outdoor public place, provided you stay 2 meters apart. Slide 3, please. Having taken the first step in carefully adjusting some of the measures and our advice to people on what to do, we have also updated what we are asking people to do, which is to stay alert, control the virus, and save lives. Staying alert for the vast majority of people still means staying at home as much as possible. But there are a range of other actions we're advising people to take. People should stay alert by working from home if you can, limiting contact with other people, keeping distance if you go out, 2 meters apart where possible, washing your hands regularly, wearing a face covering when you're in enclosed spaces where it's difficult to be socially distant, for example, in some shops and on public transport. And if anyone in your household has symptoms, you all need to self-isolate. Because if everyone stays alert and follows the rules, we can control coronavirus by keeping the R down and reducing the number of infections. This is how we can continue to save lives as we begin as a nation to recover from coronavirus. But in order to definitively conquer this disease, we need to find a safe, workable vaccine. Last month, I announced a new vaccine task force to coordinate the efforts of government, academia, and industry in the critical mission to find a vaccine. I'm very proud of how quickly our scientists and researchers have come together in their efforts to develop a vaccine that will combat coronavirus. Their work has meant that two of the world's frontrunners to develop a vaccine are right here in the UK, at the University of Oxford and Imperial College London. The first clinical trial of the Oxford vaccine is progressing well, with all phase 1 participants having received their vaccine dose on schedule earlier this week. They're now being monitored closely by the clinical trial team. The speed at which Oxford University has designed and organised these complex trials is genuinely unprecedented. Imperial College are also making good progress, and we will be looking to move into clinical trials by mid-June, with larger scale trials planned to begin in October. So far, the government has invested £47 million in the Oxford and Imperial vaccine programmes. But today, I can announce an additional £84 million of new government funding to help accelerate their work. This new money will help mass produce the Oxford vaccine so that if current trials are successful, we have dosages to start vaccinating the UK population straight away. The funding will also allow Imperial to launch phase 3 clinical trials for its vaccine later this year. I can also confirm that with government support, Oxford University has finalised a global licensing agreement with AstraZeneca for the commercialisation and manufacturing of the Oxford vaccine. This means that if the vaccine is successful, AstraZeneca will work to make 30 million doses available by September for the UK, as part of an agreement at over 100 million doses in total. The UK will be first to get access. And we can also ensure that in addition to supporting people here in the UK, we're able to make the vaccine available to developing countries at the lowest possible cost. To further support our domestic manufacturing capability, last month I announced that the government will accelerate building the UK's first vaccines manufacturing innovation centre, which is based at Harwell in Oxfordshire. And today, I can announce that we will invest up to a further £93 million in the centre, ensuring that it opens in summer 2021, a full 12 months ahead of schedule. The centre, which is already under construction, will have capacity to produce enough vaccine doses to serve the entire UK population in as little as 6 months. But if, and it is a big if, a successful vaccine is available later this year, we will need to be in a position to manufacture it at scale and quickly. So whilst the centre is being built, the government will establish a rapid deployment facility thanks to a further investment of £38 million to begin coronavirus vaccine manufacturing at scale from this summer. This facility will support efforts to ensure a vaccine is widely available for the UK public as soon as possible. In total, the government has now committed over £250 million towards developing a vaccine in the UK. But there are no certainties. In spite of the tireless efforts of our scientists, it is possible that we may never find a successful coronavirus vaccine. So we also need to look at other drug treatments and therapeutics for those who get the virus. Treatments that could prevent people progressing to severe illness or help save lives of those with serious symptoms. Whilst there are currently no drugs in the world that have been clinically proven to treat coronavirus, the government is working with our scientists and medical experts to identify promising candidates. This collaborative UK programme, known as Accord, aims to get an early indication of drug treatment's effectiveness in treating coronavirus. And today, I can report that 6 drugs have now entered initial live clinical trials. If positive results are seen, they will advance into larger scale trials. Our scientists are working tirelessly to develop vaccines and drug treatments, condensing work that would usually take years into months and even weeks. Their drive and dedication inspires us all, and with their help, we will overcome coronavirus. Steve, could I ask you to present the rest of today's slides, please?
Thank you, Secretary of State, and good afternoon. Before I present today's data slides, I'd like to provide a brief update on how the NHS has been responding to coronavirus. As I'm sure everybody knows, NHS staff have been working around the clock to respond to the coronavirus pandemic, while at the same time ensuring that essential and urgent services, such as A&Es and specialist care for stroke and heart attacks, continue in as safe a way as possible. But we have been really concerned that a combination of worries about the virus and not wanting to be a burden on NHS staff has meant that some people haven't come forward for care for themselves or their families when they would usually have done so. And we saw that in the record low number of A&E attendances that we saw last month. The majority of the reduced attendances were for lower risk conditions. So, for example, sprains were down by 80%, alcohol intoxication by just under 60%, and finger wounds down by just under 50%. But we also worried that within that fall in attendances were people who should have come to A&E and whose health might be put at risk by not doing so. But encouragingly, the latest data suggests that since we launched our Help Us, Help You campaign, the number of people attending with symptoms of heart attacks, for instance, has increased back towards that we would expect ordinarily. Now, that doesn't mean that more people are having these problems. It means that the 50% drop in people seeking help has now gone back to normal in the past month. And it shows that the message we've been getting out, use the NHS as normal when you need it, is being heard. But there's no room for complacency. And so we will continue to remind you that the NHS is there for you when you need it. Expectant mums worry about the movement of their babies, anyone experiencing symptoms of a stroke, or, for instance, patients of children with emergency asthma attacks. While at the same time, hospitals have in place the infection control mechanisms in their A&Es and in their acute wards that ensures that everybody can be treated safely. If I can now turn to today's data slides. These are in the usual order, starting first with data from the social distancing that we've all been asked to carry out over the last number of weeks. And again, you can see, as we've shown you before, a variety of data from different modes of transport, including public transport, where you will see that there has been a big reduction in rail, in transport in London, and in buses throughout the country. Also in vehicles, although, as we've noted previously, that has started to increase a bit over the last few weeks. Next slide, please. The next slide takes us to testing. You have heard today's testing figures, and you will know that there has been a large increase in the amount of testing capacity, and that has been matched with increases in the number of tests that are being carried out each day. That in turn means that we're able to confirm cases of coronavirus by test positive. And as I've said before, the number of daily confirmed positive cases is staying fairly stable. And that is in the context of an increasing testing program, which mirrors the observation that the spread of this infection in the community is falling. But as I've also said previously, the only way we will continue to ensure that happens is by complying with the social distancing measures that we have in place. Next slide. Now we move on to data from hospitals, and there are two graphs here. The first at the top shows the new daily admissions of patients with coronavirus, and you can see that since a peak in April, the number of patients in our hospitals with coronavirus has steadily fallen, and it continues to fall, albeit on a slow decline. You can also see that that's mirrored in our sickest patients who require treatment in our critical care facilities, our ITUs, and you can see that as a proportion, there has been a steady fall throughout all parts of the UK over the last number of weeks. And that is also reflected in a fall in the absolute numbers of patients who are in our critical care facilities. Next slide. This shows more generally the number of people in hospital. you can see that there are 10,000, just over 10,000 people in hospital with COVID-19, but that represents a fall of around 1,800 from the same day last week. So steady declines in the overall number of people on all wards in our hospitals. And you can see in a regional breakdown that the reduction has been greatest in London, but the fall is also occurring in other parts of the country, although at a slower decline in some areas. And then the next slide, the final slide, shows the sad deaths that we've had from COVID-19. And again, you have heard today's figures from the Secretary of State. The chart shows those daily figures in all settings. There is variation from day to day, particularly at weekends where reporting may lag. But the important part of that chart to look at is the 7-day rolling average, which has been falling and continues to fall. And once again, this reflects that the social distancing measures that have been put in place and the public's compliance with them has led through to a reduction, not just in hospital admissions, but also in deaths. Thank you.
Steve, thank you very much for that. I think people watching will, I'm quite sure, be aware that Zoom users are encountering some issues at the moment, and so unfortunately we won't be able to get any journalists live on screen. Instead, I'll be reading out their questions which have been sent in. But let's start with the first question from the public. Peter from County Durham.
The R rate in the North East and Yorkshire is now the highest in England. Does the government acknowledge that a phased, geographically based lifting of the lockdown would have been a better option?
Thank you very much for that, Peter. Look, what I would say is that we have taken a whole of UK approach to this whole issue, and of course, as national monitoring becomes much more precise and larger scale, one can look to see what you might do at a level of devolved administrations or indeed regions. But I think it is too soon for any of that right now, and that is why we continue to take a whole of UK approach on this. Steve, do you want to comment any further on R?
Yes, I think that's exactly the point. There will be variation between different parts of the country that occurs naturally in epidemics. We see that, for instance, in the flu season each winter. I think what's important going forward, as the Secretary of State has said, is that increasingly we will be able to measure R direct. The Office for National Statistics this week provided the first publication of their direct testing of a random sample of the population, and over the next few weeks, as that data is available longitudinally, week on week, and as that programme expands, we will have much better information of the directly measured R rate, rather than R rate that is derived from models and other observations. And that, I think, will give us a clearer picture of exactly how the infection is progressing in different parts of the country.
Great, thank you, Steve. The next question is from a member of the public, from Miriam from Solihull. Let me read that out. It said, why are visitors from France to UK to be exempt from the proposed quarantine rules? Well, can I just say that firstly, I think what we've been very keen on as part of the whole process is to keep the R rate down. And it's really important that we do that. We keep this below 1. That is why we are going to be introducing quarantining measures, particularly important now that the transmission rate domestically has come down. And I just want to be clear on this, is that I don't think there's a trade-off between the health of the nation and the health of the economy. Miriam makes reference to France. There have been discussions between the Prime Minister and President Macron. We are, when details become available, we will set them out. But what I would say is that what is important to realise, the reason we're going to be introducing quarantine measures with some limited exceptions is precisely because we want to protect the UK population now that they have made sacrifices and managed to get the R rate below 1. Right, I think let's move on to the journalists. I think the first question is from Vicky Young from the BBC. Vicky has asked the following question, which is that, are you guaranteeing that a test, track and trace system for teachers and pupils will be in place by the 1st of June, when many primary school pupils are due to return to classrooms. I think, firstly, I want to thank teachers because they have managed to keep schools open for vulnerable children and indeed for the children of essential workers during this pandemic period, and they absolutely deserve our thanks. We have set out, the Education Secretary has set out how one would operate in a school setting, and safety is absolutely paramount. We want to make sure that pupils are safe, and of course teachers are safe as well. And that's why we've set out measures talking about the fact that we have smaller numbers of class sizes, we limit contact, we make sure that we also ensure much more regular cleaning of surfaces, that we have children washing their hands, so that whole issue around hygiene. That is how we're going to make sure that we keep pupils and teachers safe, and we will continue to have those discussions with teachers. What I would say again is that we've seen in the last few days some of the biggest academy chains saying that they will look to open if the government says it is safe, earliest by the 1st of June, to get primary school kids who are in reception year 1 and year 6 back into school, but absolutely safety is paramount. Should we have the second question from the media? It's from Shahab Khan at ITV. We are starting to see regional differences in the response to coronavirus. Some regions will not be taking the government's advice and opening schools. Are you concerned about the regional discrepancies? Are you happy to encourage different regional responses? Well, can I just build on the answer that I gave to the question from Vicky Young at the BBC? The reason that we, of course, have said that we want to see primary school children back first is because we all know that early learning is absolutely vital. Those early years are absolutely vital in terms of developing cognitive skills and emotional skills. And, this is aimed at children who are benefiting from getting those core skills of reading, writing, arithmetic. And that is why we have set out that at the earliest we would do this by June. We will continue to have discussions with teachers, head teachers. We want everyone to feel safe, but what we have set out is something that we're talking about for across the whole country. And as I said, there are academy chains across the country who have said that they will look to return primary school kids to school when the government says it is safe to do so. I don't know, Steve.
I don't think I've got anything to add on that question. Okay,
very good. The next question is from Charlotte Ivers at Talk Radio. It's for Stephen Powers. One of the government's 5 tests for lifting lockdown is that any supply issues with PPE and tests are resolved and the NHS can meet future demand. Are we there yet? And if not, what is your best estimate for when we will be there?
So thank you, Charlotte. So I think there are 3 separate questions there, one on PPE, one on testing, and then on the more general question of the NHS capacity to meet COVID-19 going forward. So on the first 2, of course, government is leading on the procurement of PPE and on the provision of tests. The situation with PPE has gradually improved over the last few weeks, but I do understand that it continues to be a challenge in terms of international procurement at a time when many countries are sourcing PPE. What's important, as I've often said, is that for frontline staff, that they do have the confidence that they are supplied with the PPE that they need to treat their patients and the people in their care safely, to keep the patients safe and themselves safe. So I'm confident that the government is addressing that, but I don't underestimate the challenges going forward. On testing, as you have heard, there has been an increase in the capacity for testing. Prime Minister has set another ambition within the NHS. We are doing our part in the NHS labs as part of that testing programme. We have been expanding the availability of tests to those both that we look after and to our staff. So to give you some insight into that, we have been, for several weeks now, testing all patients who present to our hospitals with an emergency, whether or not they have symptoms of COVID-19, so that we can absolutely ensure that we've picked up all people who are infected, who are coming into hospital. We have recently issued guidance in the last week around elective admission, so people who will be coming into hospital not as an emergency but for planned procedures, and how we can ensure that together with testing they can come in COVID-free and safely. We have been testing staff and indeed all other key workers, but particularly staff in the NHS who are symptomatic with COVID-19 symptoms. But we have also asked our hospitals, as capacity increases, to increasingly test staff who have no symptoms, who have very mild symptoms, to ensure that we are picking up as many potential cases as possible. So that is how in the NHS we have been able to use our testing capacity to increase our testing and our understanding of how this virus is transmitted. And then finally, on NHS future demand, so I think one of the things that we should be proudest of is that our NHS staff have acted magnificently over the last 2 months to ensure that NHS capacity has always been there for the surge that we have seen in coronavirus patients. At no time did we run out of capacity, either in our general wards or in our intensive care units. And the graphs I showed you earlier showed how we saw that increase in patients, both in wards and in ITUs, but at no time did we run out of our ability to treat people. And we always had spare capacity. There were always a large number of intensive care beds that could have been brought on if we needed them, including those in the Nightingale. And I'm confident going forward that we will be working with the NHS to ensure that that remains the case, and that we will have capacity in place to ensure that we will be able to cope with patients who unfortunately need to be admitted with COVID-19. But of course the other part of that is to ensure that everybody in the public, that we all comply with the social distancing measures that we are being asked to comply with at any particular point in this epidemic, because it's only by doing that and keeping the R number below 1, so the level of infection low and falling in the population, that capacity can be there but won't need to be used. So success for us is capacity that we build in to manage any surge, but not having to use that because the R is below 1 and transmission rates are low, and we all have our place to play in that.
Great, thank you for that, Steve. The next question is from Francis Elliott at The Times. Will the UK have enough capacity for the domestic production of the vaccine by the time one is developed, or will we be relying to some degree on other nations to supply? Well, Francis, hopefully the statement I made has made that clear. We have set in place a rapid deployment facility as well, so that we are ready to start producing in the summer of this year. And I've also announced today the agreement that has been reached between AstraZeneca and Oxford to make sure that by September we have up to 30 million vaccine doses available as part of 100 million in total. Should we have the next question? It's from Martin Brown at The Express. Will the government consider changing or lifting the current 14-day quarantine restrictions on arrivals to help boost the economy? And does the Secretary of State agree with Heathrow boss John Holland Kay, who said today that if the right measures are put in place, a free flow of flights to and from the UK could resume in the next month or so? Well, Martin, this question obviously a variation if it was raised by Miriam from Solihull. Again, I think what I would say is that what is absolutely vital and what is very important for us to realise is that the health of the nation is not in some way different from making sure that we take care of the health of the economy. And in fact, all the measures that we have taken so far is about protecting lives and also livelihoods as well. And I recognise that quarantining measures will put restrictions on businesses being able to travel, business people being able to travel. We will be setting out shortly the exemptions, and of course one of the exemptions we have talked about is people who are bringing freight in, so freight drivers. But the key thing right now is to make sure that we keep that R down. And I think in the comments that John Holland Kay made this morning, which I also listened into, I think he understood the reason that we were doing this. And what I would say is during this period, we've of course also found more remote ways of working, and it's going to be quite interesting to see how businesses, particularly service-type businesses, adjust to that going forward. Thank you for that. So I think we've got a final question from Rupanjana Datta from the Asian Voice. One of our headline stories highlighted the language and cultural barriers when it comes to contact tracing, which means recruitment within the BAME community is essential. What are you doing to address this recruitment challenge? Rupanjana, if I can just say in terms of the issue around contact tracing, we've now got over 17,000 people recruited to that. We are very much on target to make sure that we have the right number of people. And actually, this is also a question of making sure that people from across all communities are able to come forward for this really vital task as well. And I know one of the big concerns has been within the BMA community is being disproportionately impacted by the virus. There is work that is ongoing in terms of looking at studies on that, and perhaps I can pass over to Steve to comment a little bit on that particular point. But just to say, in terms of contact tracing, I think that's a very important point, and we need to make sure that all communities are represented as part of the team that does the contact tracing.
Thank you very much. So on that specific point, I do agree that it is important that as we move to a contact tracing, to a track and trace plan, and that gets rolled out, that it is available to all, and that we pay particular emphasis to those communities that for whatever reason may not always engage in track and trace, or difficult to reach communities for whatever reasons. And Rupanjana has there highlighted issues around language and cultural barriers, but there are other examples in other communities as well where there may be other barriers that need to be taken into account. So I absolutely agree that it's important that that is thought of, and that we have representational recruitment so that we can effectively work with various communities. On the point about the BAME community being affected by coronavirus, as I've said before, and I know others standing here have said, that's a really, really important question that we take incredibly serious. I do as a clinician and as a doctor. Public Health England, as I'm sure you know, have been asked to look into this, and that work is ongoing to understand the particular risk factors that the BAME community may have for coronavirus, and specifically with the NHS, of course, where we have a high proportion of staff, doctors, nurses and other clinicians from the BAME community. It's really important as an employer, as a healthcare system, that we are able to look after those staff, to reassure them, to risk assess them individually, and to ensure that we put in place the measures that might be required to keep them safe. And it's for that reason that we've been working with independent experts, and through NHS employers, we issued guidance to NHS employers only last week, additional guidance on how they might approach that risk assessment of all staff, but in particular members of the BAME community who do such a great job for us in the NHS.
Steve, thank you very much. We've come to the end of the press conference, and could I once again thank all members of the public for everything that you are doing individually to ensure that we keep the R rate down. And I just end with our overall message, which is please stay alert, control the virus, and save lives. Thank you.